Welcome. Join us in an insight of experiences in women's shelters during the COVID-19 pandemic. In this performance, we have taken meaningful excerpts from interviews that were conducted. The responses of these interview questions are from the workers at these women's shelters.
When discussing this project with an acquaintance, she mentioned that she used to work with abused women, particularly women who did not want to be removed from their abused situations. The chalk-like substance was used to prevent women from hurting themselves or the employees. When she would arrive back home from work, her clothes would be covered in white handprints.
We'd be in such a better place if before COVID-19 we invested in each other in a way that was going to address the issues of gender-based violence and sexual violence. So if we had a shelter where everybody has their own bedroom and everybody has their own bathroom, I wouldn't need to go to a hotel. I wouldn't need to move women out of a super secure facility into a more precarious situation just because of the design of the building. So there's that. If there was a universal basic income, we wouldn't want to be in the situation that we're in.
In
2020, 1,550 cases of domestic violence were reported in the City of London.
If we devoted resources to we know what works, which is preventative care and preventative sort of investment in community, we would not be experiencing the massive rates of homicide at the hands of intimate partner violence that we are experiencing in the province of Ontario. I think a lot of people want to know what's a quick fix, like what investment could the provincial government or could a ministry or could the municipality or could whoever do right now to make your life easier? And the fact of the matter is that if you can just fucking listen when people are saying, like, you need to give us the amount of resources that we need to combat this massive issue of gender-based violence and sexual violence in the first place.
With the number of calls or the number of clients we have in the home, it really creates that anxiety of like having to keep up with everything to make sure the home is safe for the clients, but for the staff as well.
In 2020, ANOVA received 11,257 crisis calls relating to domestic and sexual violence. In 2021, they still received 8,300 calls.
There's a huge housing crisis. Like I mentioned, for social housing, there's a wait list of like 9 to 20 years in some areas. And as much as the government is trying to build more social housing, they're not doing a fast enough job or a good enough job, because the housing market itself is privatized. And so why would they want to take money away that they're receiving for free to be able to create money for people who aren't working hard or contributing to society, as it were?
The waitlist for women fleeing cases of domestic violence with priority status for housing ranges from 1 to 3 years. This was prior to the outbreak of the COVID-19 pandemic and has only been exacerbated.
So we had a mother and 2 young children who were in our Ottawa location, and this woman had been fleeing domestic violence. She actually had stayed with us for about a year, and her year was coming up. So we were reevaluating her stay within our program and whether or not we were the best fit, or if we needed to transition her to a different program. And the reason being was that her immigration status had not come through, even though, you know, with the pandemic, of course, like everything takes a really long time for it to come through. But this took like an extended period of time. And so she was losing hope and faith that, like, you know, her status was going to come through, that she would ever be able to get housing. Within a span of 2 weeks, she got her status, her PR status, and a week after that, we had found and secured her a home. So it's amazing how fast transitions happen and how quickly hope can get restored with the right things and with the right tools.
We try to normalize it as much as possible. We try to share experiences, show support, provide knowledge. We normalize it in the sense of also showing that everybody in the program, especially when they're in our transitional home program, is accessing services the same way. Obviously, it's different because each program is designed for individuals in a different way. So counseling is one thing that's the same across the board. Caseworker, something that's the same across the board, meaning that those are the 2 primary services that they'll access in the home.
And I think when women come into our homes and they see that other women there are also sharing the same experience, possibly as her right, it kind of helps them settle into the program because everyone around her has accepted the program and they're all taking part in it.
One of the biggest one was like, the self-isolation period and, figuring those things out. So one of the policies that we actually put in place was to ensure that clients and residents were able to self-isolate before they're able to access the programs with Sakina Homes. And the reason that we did that, and because we're a small not-for-profit, we're not able to provide like a hotel space, or because a lot of those programs are actually government funded, and we're not government funded. So we weren't able to provide that space and that service. And so like there was that sense of like fear that a lot of residents who were coming from across the border or from across this like over internationally, that where am I going to go if I can't access your services right away? And so like it did definitely affect our residents and our clients in terms of feeling safe and secure while they're entering Canada.
We
You should not shy away from language. It's rape, not sexual assault.
The stay-at-home orders affected survivors, as their home is not safe. Normally, they can call and try to escape, but not during COVID. A number of clients asked to stop their counseling as a result of fear around COVID.
Last year,
Inova Homes was forced to turn away 1,793 people at the door due to complications of the COVID-19 pandemic.
Abusers were using public health directives or even lying about them to keep their victims at home. There were phone calls from victims that were locked in bathrooms, and we started getting direct messages or Facebook messages from those needing help and to escape.
You kind of stop believing that the system's working for you, or you stop having faith.
And so like every single time there was a mandate, like a Ministry of Health change, we would alter our policies and let all of our staff and our residents know, just to make sure that we didn't have any outbreaks or any COVID concerns. And I'm going to knock on wood here, but thankfully, up to now we haven't. And it's because we have been very diligent and following the proper guidelines and proper policies and like making sure our staff as well as our residents do so as well.
So like we've had calls in like the territories and other provinces, and then we keep track, of course, of all the calls and all the clients and residents that we do take. And if we have the capability of expanding and we have the manpower as well as the resources.
26% of youth seeking shelter are under 25. 76% have experienced 2 forms of abuse.
Absolutely, because we can't do it alone. So for example, there's a limitation in terms of the language of counseling that we offer. So on our website, we're actually looking for and/or are the speaking counselor. And that's because we've seen the increase in the growth, in the need of, order speaking clients. And, providing mental health services that cater to that population would be ideal. With that being said, if we can't hire somebody that would fill that need, we would obviously outsource and outreach.
I can add something to that if that's okay. In terms of the services that we provide, we do have multiple languages that we offer, from our caseworkers, from counselors, and other various staff, so that we can cater to the needs of the people that we're seeing. So we do a demographic profile of any client or resident that come into our program, just to kind of understand if we need to expand in a different language or in a different culture so that we can be providing culturally sensitive services. So we do look at that. And we also understand that migrating, no matter where you're doing it from, whether it's from the US to Canada or from province to a different province, is a traumatic experience. And so that's why we offer mental health support. We offer check-ins, like a very trauma-focused service, so that we're understanding that sometimes behaviors that may come up or any situations that may come up may be triggering because of the migration aspect and because of the trauma.
From 2019 to 2020, reported incidents of human trafficking jumped from 84 to 147.
And it's such a hard time to get, a hold of like a government agency to have someone contact you back. So like there's been a delay as well. There's not just gaps, but there's been such a delay in services since the pandemic started. So I think that was also like a harsh reality in our work where, something that you can get done within a week is now taking, 234 weeks to complete, right? So I think that also is a challenge that our clients have faced when accessing services.
We want to make sure that we're servicing the greater community, wherever the need may be. So we will do like needs assessments. We'll reach out to different communities, we'll do presentations, and I think one of the gaps that we've seen is access to knowledge, like we've mentioned previously. And so as hopefully when the pandemic dies, we're able to facilitate workshops and things like that.
Team is tired, exhausted, delivering trauma and violence-informed care in a way that feels incongruent to their values. With layers of PPE, speaking to someone through an intercom, asking kids to wear masks when they're feeling stressed, triggering, no space and good alternatives. It leaves a tough impact on the staff. It's devastating and exhausting. They're held to a standard of needing to work like healthcare workers.
By voting for a government that values the work of women, the number of times staff has had to fight to get supplies such as PPE.
I guess I'll speak to that one. So Sakina Homes was founded in 2018, as there was a noticeable need for the Muslim community, especially targeting women and children. What we found was that women and children are often left in situations that are violent and that are unsafe, and that they really needed a safe place to go. So Sakina Homes was founded in creating transitional homes. In terms of providing that service, we've expanded our services since 2018.
So we call it the market for people by the people. It's it'll be a place where people can come, anyone who's facing food insecurity. We do have an intake process that they have to sign up before coming, but we have like a market set up for them where they'll be able to come and kind of shop for themselves free of cost with whatever food items they may need for them and their families. So we'll be providing perishable foods, non-perishable foods, baby items such as diapers and formula and wipes, and then also like basic need items like shampoo, toothpaste, toothbrushes, and feminine hygiene products.
Language can often be a barrier as well to the receiving services.
%16.7% of child protection cases opened in the last year were for children exposed to domestic violence.
There's a lot of shame associated in seeking help. It's this thought process that any problem that exists in the home needs to stay in the home. But that's not always the best solution.
Thank you.
Thank you.